study, we will try to be identifying kinesiophobia to prevent chronic post-surgical pain after spine surgery. With about 6 million children undergoing surgery on an annual basis, about 20% of them continue to have pain after surgery. That's 1.2 million of them. It's a significant amount. With chronic post-surgical pain, it is pain that persists for over 3 months well after the tissues have healed. And as we have recently learned, pediatric patients who undergo surgery end up being more sensitive to pain. And this is because of the invasive natures of the surgery that make their nervous system more sensitive to pain responses. And with that, they soon adopt a lifestyle of reduced sleep quality, increased depression, anxiety, reduced quality of health that can persist into adulthood, and that is something we want to avoid. Before we go into talking about scoliosis surgery, there is spinal fusion surgery that treats scoliosis, which is a spinal deformity. This is a spinal fusion surgery with instrumentation, and essentially it corrects the curve. What the surgeon will do, essentially, is it will first cut off the facet joints so that the surgeon can see where to put the screws, so that the screws don't end up hurting the nerves either. As you can see here, they're being screwed in, and it goes really deep into the body of the vertebrae. After that, all of them being screwed in, there's a rod that's fixed. And slowly but surely, the spine gets realigned. As shown here, they're being fixated. And then the other side gets placed, and you'll see that the shoulders are being leveled together, and the verts go back in place. A consequence of not getting the surgery, the spine can actually push on the lungs, and to avoid it from coming back, the surgeon actually applies bone grafts, and by crushing bones, the spinous processes are removed, and they place it along the vertebrae. So that way, when the patient recovers, the bone is fused together, and the spine will really not move. So you can see it's a very invasive surgery, and this is before and after surgery. So surgery is scary, and thousands of children undergo the surgery, so it is very important that their recovery is the best that we can offer. This surgery affects the musculoskeletal system, and what that means is that their locomotion, their mobility will be affected. This comes to kinesiophobia. It is a mouthful, but if we break it down, kinesio means human body in motion, and phobia means fear. And when you put that together, it's fear of movement, of painful injury, or re-injury. Kinesiophobia has also been referred to as a phobic behavior of chronic pain, as anxiety and depression should. Let me explain this with the fear avoidance model that was also described previously, but I've adapted to the surgery. So the tissue injury, and with that invasive surgery, there's reduced flexibility. So there's 2 paths that a patient can go. The path on the right here, with no fear, you can see that with the reduced flexibility, they're not intimidated by it, so they'll confront it and adapt to it. And this picture is an actual patient who has undergone the surgery. And she's back to doing tumbling and gymnastics with these rods and screws placed in her back. That's amazing. And as for this patient here, we can see that he's not really having a good time. And with that reduced flexibility, he has ended up catastrophizing it, and that led to the fear of movement and to really avoiding activities that are perceived to be harmful. And not only that, we need to consider that these rods reduce their flexibility. So what that means is doing activities that they used to do can be frustratingly difficult. And with that, they can also get criticized, and that can be embarrassing, which further encourages avoidance of this. And that encourages the disuse, depression, and increased disability, and they enter this vicious cycle. Research has also examined that, and they've also realized that with more sudden traumatic insults, such as surgery, patients like that are more prone to developing kinesiophobia than those who develop pain gradually. Pain, as we all know it, is a complicated phenomenon. And the way it goes up to our brain and how it processes through the frontal cortex, such as the prefrontal cortex, the amygdala, the insula, our past pain experiences, our parents' reactions to our pain, and our personality shapes our responses. And that response can either be confront that pain or to fear that pain. And here we have a video of a patient getting up from her surgery, and you see how invasive with how long the surgery scar is. So she's trying to sit and she's trying to stand up. And actually, patients who undergo this surgery, the spinal fusion surgery with instrumentation, they're encouraged to have a short recovery time. So that encourages early mobilization and a faster recovery. But what if you're discharged, you recover, but you still have pain? So let's put things on the table. You have a back as stiff as the titanium rods in your spine. You have screws fixed into the spine again. Your flexibility is reduced, and you have pain. Would you still want to move? And if you don't want to move, is that kinesiophobia? How do you detect it? At this point, we reliably detect kinesiophobia with a subjective Subreport measure called the Tampa scale for kinesiophobia. Although it is a questionnaire, to better help these patients, it would be best that we find an objective measure to detect it, because we are testing something physical on paper. So there's certainly room for improvement. So why not take the opportunity to find a way to improve the detection of kinesiophobia objectively in pediatric surgery? And why pediatrics? Well, adolescents who have early signs of kinesiophobia, if we can detect it, that can prevent a negative development into adulthood. Because adolescence, as we all know it and have experienced it, is a critical stage that sets a solid foundation to adulthood. With no limited motions, the freedom and having the freedom to move, it allows us to develop a solid relationship to socially, emotionally, and cognitively develop. That is why I'm stressing the need for an objective measure to detect kinesiophobia, and why clinicians need to realize it is a problem that we must address. If not, these adolescents with kinesiophobia, what can happen to them is that they can adopt ill behaviors and then develop comorbidities like disability, and what comes around goes around. It will become a social burden to all of us. So, what is it that we can do to detect kinesiophobia objectively? In the literature, what we have found, although there's conflicting evidence, there have been physical objective assessments that's been given to detect it. With conflicting evidence, we have seen that many of them either have a hard time segregating physical limitations from true kinesiophobia, or the activities were actually not difficult enough to trigger kinesiophobia. And we also need to realize that not all assessments will fit everyone, so not everyone will fit as one-size-fits-all mold. So different assessments would have to be tailored to a specific population of patients. And in my case, it is kinesiophobia and pediatric spinal fusion surgery with instrumentation. So this is for my master's. And my experimental design is that I picked 3 exercises that may be perceived as harmful in patients that have undergone the surgery. And in fact, physical therapists give these exercises to patients to not only strengthen their back, but to also try to ease their lumbar pain. I will be comparing their performances before and after surgery. But then I thought, what's the next leap that I could take to further advance the objective detection of kinesiophobia? So let's remind ourselves of how much we've advanced the technology. I'll introduce to you wireless sensor foot insoles. What they do is that without wires, you're not being confined into a clinical lab. So what you can do with that is you can actually obtain data while the patient's in the unit or at home. And what I want to do with that is, while the patient is hospitalized, I want to quantify the mobilization and see if there's an association with kinesiophobia development after surgery. As you can see here, what the sensors take in, they take on pressure, weight, and balance and motion. So you can see the data being visualized, and that with to a 3D map and a colorized intensity of the pressure and weight. So it's very cool. So as a final remark, I would like to stress the importance of detecting kinesiophobia objectively. Kinesiophobia, of all things, should not limit us from achieving greatness, because having the movement to move, the freedom to move, is something that makes us whole and complete. So please join us in the mission to detect kinesiophobia objectively. Thank you.